Hi, I'm Meshal Malik and you're watching Indus Special. Global coronavirus infections have topped 13 million ever since the new virus was reported to the World Health Organization on the 31st of December. Since then, the global community has fast-tracked efforts to find an effective and safe vaccine. Today, we discuss how far we are in finding that vaccine and what will it take to make a vaccine that is accessible to all. Joining us today for this conversation is Dr. Munir, who's a virologist from Lancaster University. He is also at the forefront of developing vaccines and with the COVID pandemic and dealing with it. Thank you so much, Dr. Munir, for joining us and welcome to the show. Good to have you back. Dr. Munir, now let's just begin from the basics of where we are standing today. How many vaccine trials have gone to the human trial stage, and how many are showing potential?
Today morning, basically, we had our WHO meeting to discuss about the current vaccine development, because I sit into the expert panel of World Health Organization. So as it stands by today morning, we have around 140 vaccines. Out of those, 19 are in phase 1 trial, 11 are in phase 2, and 3 are in phase 3 trial. And those are in phase 3 trial, they are at the moment inducing both the cellular and humoral immune responses. These are two different arms of the immunity for which we count very high onto the vaccine. So as it stands now, all vaccines that have passed into phase 3 trial, they are promising.
Right. Just now break it down for the common viewers watching this. When a vaccine enters the phase 3 trial, how long does it take for the efficacy of it to be determined? What more steps need to be taken for the safety of it to be determined?
For any vaccine to be registered, 3 phases have to be completed. The last phase is phase 3 trial, which is relatively large, and it involves people from different comorbidities, for example, different age group, pregnant women, children. So different groups are involved so that we can predict the real situation in the field. So phase 3 trial is dependent on how much is the disease in the field. So what we normally do is that we divide people into 2 groups. One group take the placebo as a control, and other group get the vaccine, and we ask them to go into the routine life and see how many will get the infection. So now just assume if the infection in the population is relatively low, it will take a longer time to estimate that safety. But if the disease is very high into the country or the site where the safety trial is being conducted, that means that the time will be very short. So that is one of the reasons that most of the vaccines, those are being trialed now in phase 3, they are in the countries where the disease incidence is very high. For example, in the UK, we don't have that much disease any longer. So our vaccine, the Oxford vaccine, is being trialed in South Africa and in Brazil, because where the disease is very high. So it all depends on to the incidence of the disease, but generally it takes 3 to 6 months to really prove that it is safe and efficacious against the natural infection.
Right, you mentioned the Oxford trial right here, the Oxford vaccine, which is making quite a lot of stir. How optimistic are you about that one?
So based on my observation, the plus side we are seeing with the Oxford vaccine is that it is having both arms of immune system induced. So it induced the antibodies, like the same as Moderna, Pfizer, or and biotech does at the same scale. But we have had some concerns that we don't know how long these antibodies will remain. So if someone is immunized after 3 or 4 months, if the antibodies are gone, that means they would probably be at the same stage of susceptibility to get reinfected. But this vaccine, based on the conversation, appear to induce the T-cell immune responses, which mean that the cellular immune system will also be very high. So even if the antibodies go down, these T-cells will stimulate the immune system and basically kill the cells that are infected with the virus. So it can compensate for the waning out of the antibodies. So all in all, it is good as it stands at the moment. However, the real challenge comes when we will see that these induced immune responses will protect against the natural infection. That required phase 3 data that is under progress, and it is not yet released. So as it stands now, it is promising, nothing to stop onto the phase 3 trial, but actual challenge come when the data will become available from phase 3 trial.
Right. Dr. Munir, what percentage of efficacy would you say are global experts aiming for when developing a vaccine for COVID-19?
Thank you very much, Michelle. This is a very smart question because this is the real challenge at this moment, how effective a vaccine would be to get approval from the regulators. So FDA has made a statement 2 weeks before that any vaccine that would protect less than 50%, they will not recognize that. And according to World Health Organization, it has to be more than 75%. So if 100 people are immunized, at least 75 out of 100 should be protected against the infection before a vaccine would be considered for registration. And this is for those who are in the front running into the approval process. So as we have more vaccines coming up, if any vaccine that would appear to be more efficacious, it would replace the previous one, or at least would run in parallel for the production.
Right. Dr. Mohammed Munir, I'm going to ask you that information down further for us. When you say the World Health Organization has said they will approve any vaccine 75% and above, what does that exactly mean? Does that mean the duration for how long a person who has been immunized will be protected, or does it mean the percentage of the population? What does that 75% mean?
So once the phase 3 data would become available, that will tell for how long a person who is immunized with this vaccine will be protected against the infection, and the antibody that is induced by that vaccine would stay for this duration. So that will define how many people out of the total immunized would be protected against the natural infection. So that is how we will determine how efficacious a vaccine is. So in nutshell, basically, in a given population, if 75 out of 100 people, they are protected against infection for the duration vaccine has been assessed, they are the one that will be considered for the regulation. But that we don't precisely know what would be the duration of protection, but based on our previous experiences with the coronaviruses, it would not be less than a year.
Right, not less than a year previous experiences. Now, I really want to put this question to you, and I know I ask this every time, but it's been a long time since we've last talked about natural immunity from this virus, about going towards herd immunity and naturally moving towards it. What do we know about it at this point in time?
Well, certainly herd immunity is something that we want to achieve, either through a natural course of infection, which is really costly, or through the passive immunization, which is vaccine application. So not having vaccine herd immunity is probably not achievable. But the thing that remained very controversial is that the immune response that is induced by the natural infection, for how long it is, the longevity of this immune response is not yet determined. So as I've been stating before, the antibodies start to deplete. That is very natural for any viral infection. So nothing much to worry about. The thing that would remain as a point for confirmation is that how much is the cellular immune responses, because cellular immune responses present a factory for the product. So antibodies are the products. If products are gone, as long as the factories are there, they will replenish it very effectively and with a very short time. So under the natural course of infection, we don't precisely know, because we are only down into 7 months into this pandemic, and the duration isn't enough. We didn't have enough backlog of history to determine how long the antibodies would remain. But certainly, as I've been stating before, based on the coronaviruses, both onto the animal coronaviruses and the coronaviruses that have caused infection in human, the immunity lasted effectively up to 1 year. And it started declining after 1 year and remained determined until next 2 years. Total 3 years immunity was in SARS and MERS.
Right, Dr. Mohammed Munir, there's a lot of information, as you know, an influx of it on the internet, a lot of false information out there. But what do we know for certain about any cases that have seen a person being infected twice with the coronavirus? Have we seen any of those cases as of yet?
Yeah, that is again a very important question. I think there has been quite a lot of misinformation spreading out that the person can be reinfected. To be honest, in scientific terms, I can't explain why reinfection is possible in the coronaviruses, because our body do detect these coronaviruses very effectively and induce and elicit very strong immune responses. And particularly my own research, we have noticed that SARS, and if we compare SARS, which caused pandemics back in 2002 and 2003. And this SARS-2, we have seen that this SARS-2 is more interferon sensitive. That means even the immune system of our body, if it is slightly induced, it would still be able to counteract the infection. However, when we talk about the general population, we generally talk about a consensus approach. And then there are few people, those are outlier as a variable because of genetic differences, because of underlying conditions, or because of poor infrastructure where you can miss the identification. When we talk about United States, there is not even a single case identified that has been reinfected. Most of the reinfection either came from Korea, those were initially portrayed to be reinfection, and then majority of those are in the developing countries. So my anticipation and take on that is that that is mainly because of missing the diagnosis at the first place.
Right. I'm going to shift gears here now, Dr. Mohammed Munir, and talk to you a little about the logistics of producing a vaccine and then making it accessible. What do we know about that so far? And as you are also on the panel of advisors to the World Health Organization, what plans are in place in order to make this vaccine affordable and accessible to all?
Well, thank you very much once again, Meshal, for asking this question. This is very critical, and I would like to clarify that the vaccine distribution and overall manufacturing for the COVID-19 is completely unique. A living history hasn't seen like that, not only for the development of vaccine, but when it comes to the distribution. And we should not take that one as a award that all the developing countries would get immediately the vaccines that would become available. There is a lot of competition ongoing, and I am an integral part of this whole conversation, how the distribution will be monitored. There is an organization called SAPI and Gavi. Their remit is to make the vaccine available for countries those cannot afford. However, given the unprecedented demand in the developing countries who are investing into the initial phases, they would not be, of course, allowing by any means to get the vaccine to the developing countries before they will fulfill their need. So even if the vaccine would become available in the earlier next year, the first countries who are going to get them are the Europe, who already made the contract with AstraZeneca, and Brazil also made the contract with AstraZeneca to get the seed virus. So these are the countries who are going to get the first. When it comes to the developing countries, certainly the funds from the Gavi has been already allocated a month before. We have had a big gathering here in the UK, where more than $80 billion were pledged for distribution of this vaccine around the developing countries. But the amount of the vaccine that would be distributed to the developing countries would be only for the emergency use, for the frontline workers, for people who are at extreme need on the vulnerabilities, and those are under the shielding possibilities. So all in all, it is really very challenging, and probably this is an unprecedented time to look back into this one and make some international bold decision to decide who will get the vaccine, whether the one who will invest the most or the one who are in need the most.
Right. Mohammed Munir, now draw out a timeline for us. Let's say if we're positive in thinking that a vaccine can be developed by the end of the year, and it would take another 1 year for the production or a distribution of it. By what time can we expect globally for the situation to have come to a point where we can consider opening borders, free travel? I mean, is that way off into the future, way too distant to even think about it? Or are plans and concerns of that coming up right now as we speak?
Yeah, I think one of the things that I have noticed in recent months is that people have probably overemphasized and overvalued the vaccine. Believe me or not, once even the vaccine would become available, the restriction onto the movement and our social behavior would still be there. It wouldn't be a magic bullet to curtail the whole pandemic in months. The reason being is that no vaccine is anticipated to be 100% effective. The most effective vaccine we have so far in the history is about the measles vaccine, which provides 95 to 97% protection. But that is exception. We have, for example, flu vaccine that provide only 40 to 60% protection and is still being rolled out on a yearly basis. So vaccine is not a magic bullet. That is clear. However, what we are seeing is if the speed of the development is taken at the scale where it is going now, at the end of this year, closer to the Thanksgiving date, we will be having the final results of phase 3 trial. So in the next 2 months, by the end of December, the regulator will sit onto the data and analyze whether this is good enough to be rolled out or no. If that would be the true, that means January, February would be the time to scale up and start distribution. Probably that is the time when people would start thinking about opening up at the scale where they were in the normal, especially if a larger proportion, around 60% of the people would be immunized with the vaccine. And then we add up 10 to 15%, those already have got immunity through the natural course of infection. So if we achieve in total 70%, that means we are in the position to open up. But that would take another 1 year, especially in the developing countries where the vaccine access would be really late. And until the people in the developing countries are not fully immunized, basically opening up in a limited country doesn't really help, because if the virus can spread from China to the rest of the world, from any country, it can spread to any other country.
Right. And Dr. Mohammed, the timeline and the facts and figures you give here, I'm assuming that that's the best case scenario if everything goes according to plan. Now, I want to talk about the World Health Organization and what its plans are to tackle not only misinformation, but also vaccine hesitancy. How much of a threat is the World Health Organization considering that to be once we do get an effective vaccine? We have figures out here saying that 1/3 of Americans would not get a vaccine. We know that in Europe and the anti-vaxxers movement gained a lot of momentum. What is being done about that? What are the conversations being had about that?
Absolutely. I think this is, again, very smart question, because most of the time today morning meeting was dedicated to discuss this particular matter, because there are so many still questions that need to be addressed before we can start counting on the vaccine. For example, all the trials, the data that have become available so far are in our healthy volunteers. No data yet become available on these vaccines when these will be deployed into people who already have infection. For example, HIV, immunosuppressive disease, that is one of the things that we discussed, need to be tested very carefully. Pregnant women, children, elderly people, these need to be tested before we can count on to the vaccines for its approval. So that is a worst case scenario, and we can't really count until the data would become available. And then there are other factors, as you highlighted. Anti-vaxxer are really very active here in the Europe and also in America. So the acceptance for the vaccines to be administered would again be a critical issue. And then there is a dissemination into the countries where the infrastructure is poor. I mean, we talk about polio vaccine, which is very good vaccine, yet we are not able to deliver into every corner of the world to eradicate it. And still we are seeing in Pakistan and Nigeria. So there are certainly a lot of challenges to mitigate before we can count success onto the vaccine.
Now, if this vaccine hesitancy is also related to the safety of these vaccines. When we're talking about developing a vaccine, you talked about the efficacy part of it, but also the safety part of it. Now, for example, I was talking to another health expert earlier this week who was talking about the Moderna vaccine trial and how it had mild to moderate side effects with it. What type of level of side effects or what category of side effects would you say makes a vaccine unsafe or reduces the safety of it significantly, which would translate into many individuals saying being fearful of it or being hesitant of it?
Yes, absolutely. Very, very important to understand what is our threshold and cut point to accept for the side effects. For example, taking the example of Moderna vaccine, it has, the pain at the site of injection, it has chills, it has muscle pain, and it has some fatigue as well. But those are very, signs are very low price compared to the price. So therefore, those are not considered serious until any vaccine would has any effect onto the survivability of the person, or when it comes to the overall immune response, it is going to lead to any other complication. The side effects of the vaccines are always there. I mean, I can't see any vaccine that is not having any side effect, because it is going to induce the immune system by unnatural way. So therefore, body would react against that. So certainly there would be some side effects, but those side effects that have been noticed so far are really too minor to be considered. But once again, I would like to emphasize that those side effects were in healthy volunteers in a phase 1 trial, but those could be aggravated into phase 3 trial when people with comorbidities or different age groups would be injected. And again, dose has been one of the major concerns. For example, in Moderna, 250, which was the highest dose, have high side effects compared to 25 microgram per person. But they chose 100 microgram, which appear to be a sort of fine balance between inducing immune responses versus the side effects. So side effects would certainly be considered, which are more prominent in vaccines like mRNA vaccine, which is taken by Pfizer's or Moderna. But the vaccines that are like Oxford and my vaccine, those are recombinant vectors. Those are having relatively less risk for the side effects.
Right. Dr. Mohammed Munir, I'm just going to put one last question to you. I know you're very, very busy and you're taking a lot of time out for us. Now, when we talk about the World Health Organization, I know you were very critical of its role and the lack of its role earlier on in the pandemic. How is the global community working to tackle those issues of creating a global consensus on medical information and communicating that better to the public?
Well, certainly we have only one world representation, that is World Health Organization, to deal with such pandemics. So their importance cannot be ignored or overruled. However, of course, for such a big task, there will always be glitches that need to be retrospectively looked so that we can improve on them. But as it stands now, I think World Health Organization did an incredible job, especially onto the diagnostic and the vaccine coordination around the world, because for example, in the meeting, we've been talking about setting up a solidarity trial, the trial that take all the vaccines together to test them and from all over the world. So we have selected 15 vaccines that are going to go into the solidarity trial for the efficacy. This would have not been possible without the World Health Organization, because there isn't any alternative to the global coordination. So there are pluses, but certainly there are things that need to be retrospectively looked into. For example, yet we don't know the origin of the virus, where from it has come, and why World Health Organization been so delayed in taking actions to curtail this infection, especially in the beginning days, and then the coordination between different stakeholders, especially with the United States and so on. So there are a lot of conversations ongoing within and outside of the whole organization need to be tackled very carefully. But as it stands, I think we only have hope with the World Health Organization to coordinate these larger trials so that we can get benefit of these efforts.
Right. Point. Thank you so much, Dr. Mohammed Munir, for everything you do and for joining us and taking out the time to talk to us and give us this very important information. We're going to go for a short break, but when we come back, we discuss how, with COVID-19 drastically altering life as we knew it, can we build a new normal? Stay with us. Welcome back. Now, more than 6 months of living in a world deeply impacted by the novel coronavirus, we are slowly understanding that we must adjust and accept a new normal. But what type of lifestyle do we need to build in order to cope with this evolving situation and keep our physical and mental health in check? We're joined today by Dr. Faheem Younus, Chief of Infectious Diseases at the University of Maryland, Upper Chesapeake Health, to help us answer some of these questions. Thank you so much, Dr. Faheem Younus, for joining us, and welcome to the show. Now, when experts like you claim that we need to accept COVID as a part of our lives and we need to move towards a new normal, what does that new normal entail?
I think when we understand that this is going to be here for another few months, maybe another year or two, a good example is how we drive. We don't just hand a car to a 16-year-old and say, go on the street, because they will wreck the car. And we don't stay in our homes forever scared of driving. So there are some rules, there are principles. You understand the road ethics, and then you do some training. And then after all, you start driving and you don't have accidents. So there are same parallels here. We have to wash our hands, number one. Just like before driving, you want to make sure that you're sober, you're not sleepy. You want to be first cautious.
Right.
You put a seat belt on for driving, so therefore you need to wear a face mask in this case. We don't tailgate people. We keep a distance between cars, a safe distance. So similarly, we need to keep some safe distance and avoid larger crowds. So it's those basic steps that can help us continue with our life, but with safety and precautions.
Right. Dr. Younus, thank you for that analogy. And it is one that I think really would resonate with people. But when we're talking about the duration till the vaccine comes, also talking about any new normal means talking about what happens after a vaccine comes. Now, earlier in conversation with Dr. Mohammed Munir, a virologist who joined us from the UK, was telling us that no vaccine will probably have 100% efficacy. So in that regard, there will probably have to be some permanent changes in human behavior. Do you see that in the same light?
I think it will delay things, but I don't see this permanent. And what I mean by that is correct. No vaccine is going to be 100% available, first of all. I don't think we're going to have 8 billion doses of a vaccine, number one. Number two, if a vaccine is 70 to 80% effective, I think it's good enough for us to break the communication chains and then end the pandemic. So it will be very effective. We can have a 70 to 80% vaccine. I do think life gradually comes back to normal. And the reason behind that is human body is very smart. Immune systems are extremely complex and robust. This virus may become a part of our flora. This may keep coming back every year, but it won't be able to fool the human body. An example is H1N1 influenza that came out in 2009 and created a massive pandemic. People may not remember it, but it did impact millions of people around the world. It comes every year, but it's not news anymore because our bodies have developed some antibodies and we have good vaccines. So I think, yes, life will get back to normal. It may be a new normal, but it'll be pretty good.
Right. Dr. Younus, now I hear you talking and reading your tweets as well. There is a certain kind of way you communicate this information which makes it accessible for a lot of people, which makes it likely for a lot of people to understand it. I want to take this question here. Now, talking about medical information and communicating it to the masses, not just certain people who have information, seeing how it's been done over the past 6 to 7 months, what do you think needs to change in that regard?
Yeah, I think we need to have deference to expertise, which means if this was a math question, you should not invite me and I should not be opining on it. That's not my specialty. I think I'm able to effectively do it in part because I've seen nearly 20,000 patients in my career with complex infections. And patients have all the same questions that we today as humanity have. So I'm literally doing that same micro work on a macro level. And when politicians or even those who may not belong to this specialty, for example, I should not be opining on a cancer treatment. Cancer, even though I'm a physician, even though I have expertise and I may have titles, does not make me an expert on cancer. So I think this is a very specialized field. People who have the knowledge, who have the experience, then should align with the government, and communication should be handed over to those who know exactly what they're doing. And then they should be given the trust from the governments. But unfortunately, there's this tussle. And unfortunately, that's not helping even here in US or in Pakistan or any other country, wherever. I keep saying that a divided population can never win against a united virus. I think we need to respect each other's lane. I should not be commenting on politics, on lockdowns. And those are the kind of deference to expertise which is needed.
Do you think that the situation would have been drastically different had that deference to the expertise, as you said, that would have happened?
Absolutely. It's not about what I think. You look at New Zealand, it is drastically different. New Zealand has 0 cases. You look at Vietnam. Vietnam has 0 deaths. It's the same virus. Vietnam has 100 million people. It's a poor country like us. So I think there's a list of countries that I can share with you. And unfortunately, it's still not too late for us to get our act together. I keep saying, if this was cricket match, the virus won the toss and decided to bat. I think this year, 2020, is the year of virus, when the first 1-year innings, the virus is wreaking havoc around the globe. We still may have another year or 18 months to work with this thing. It's not too late to correct course, to have deference to expertise. And countries that won't do it, regardless whether they are poor or rich, they will suffer more.
Right. Dr. Faheem Younus, I also want to ask you to help us break down misinformation, separate myths from facts. And this is, of course, regarding the nature of the coronavirus, how it's changing, whether it's mutating, whether it's becoming weaker. What do we know about that so far?
So I think it's a good question. And I think there are about 90% of the facts about this virus are now pretty clear in people's, like me, who are the experts. In our minds, are pretty clear. There are 10% things which will continue to evolve. Now, the issue is if you want to focus on that 10% where there are lots of unknowns, yes, there will be confusion. But what people should do, and I will give them just one simple advice. In a pandemic, you don't want to rely on push information. You want to pull information. What that means is you don't want to consume information that's thrown at you, whether that's through Twitter or Facebook or a TV channel or wherever. You need to be smart enough to visit the right websites, which in this case would be CDC or WHO. You can follow the experts on Twitter because now you've chosen the expert. And if you read everything on Facebook and just simply believe it, as they say, in the age of information, ignorance is a choice. Some of this confusion, honestly, I think is our choice, and we need to make better choices.
Right. A lot of these social media platforms from the get-go were trying, probably not hard enough, to try to curtail this misinformation we've been seeing. They're trying to take those measures. But of course, it's important to, as you're saying, pull out information as opposed to just see whatever exists there and take it and swallow it. I want to talk specifically about the mental health crisis we're seeing, and this is in relation to human behavior. A lot of individuals have also developed a phobia from this virus, which we're seeing translate into many extreme behaviors. As you're saying, we need to take caution, but we also need to adjust to this lifestyle. What things do you think are unnecessary, and a lot of people are putting them in their routine to stay safe from the virus?
Yeah, I think there's one word, trust. When we give honest information, and that information may not always be good. If you followed my Twitter feed, sometimes people are very unhappy with me because they feel like I'm not giving them hopeful information. And I keep telling them I'm not going to give you false hope because research shows that when you tell people the truth, they may not like it up front, but they will trust it. And when they can trust it, they can manage their life better. If you tell them the weather is beautiful, nothing's going to happen tomorrow, and tomorrow a hurricane comes, guess what? It wrecks their mental health and it wrecks their confidence in what you said to them. So it's very, very common for many politicians to come and with very good intentions try to reassure the public. When you over-reassure people and the facts don't line up, and when they see something bad happening, now they were not prepared for it, and their mind couldn't wrap the facts around the whole thing, and they lose trust. And I think it's very important for us to compassionately, in a positive way, keep telling the truth and acknowledge that, yes, it will create some distress, but keep telling them that, one day we will be out of it. With Spanish flu, the world won against that Spanish flu, even though we didn't have precautions or treatment or a vaccine. So yes, there is hope at the end of the day, but it's going to be rough in the middle.
Right. And I think something that relates to this was someone said that conspiracy theories also come from that same thing, that denial that comes when you believe for so long that this isn't going to harm you, and then you see it harming, and then you delve into conspiracy theories. Now, talking about the mental health crisis, I also want to touch upon the individuals on the front lines and what type of support governments need to extend to those individuals. And they need to keep in mind that they need to gear up for what a lot of individuals say will be a perfect storm in the winters.
Excellent question. Number one, I think remove the taboo from mental health, because in our cultures, seeking help is looked upon as a sign of weakness. First of all, that mindset needs to change. Doctors and nurses, people on the front line are just human beings like anybody else. They're burnt out. They worked very hard. They may want to take time off at this stage if things go in a lull. Hopefully, they may want to take some time off, recharge. Number two, give them good protection. When people don't have PPE, imagine if your soldiers were fighting a war without proper gear and proper ammunition, their mental health and their overall confidence will be shaken. Number two, invest in that PPE, make sure that they're getting that PPE. And number three, once again, everybody has different propensities. Some people, depression is a disease, just like high cholesterol is a disease. So some people may have that disease, and in some cases, treatments may be necessary, support groups may be necessary. Between men and women, there may be a difference. We just cannot mock this thing anymore. Let's not make fun of it, acknowledge it, have compassion, and then we can develop some very specific treatments, which will not be one size fits all. It'll be different for different people.
Right. There's also a concern about, as you say, that we need to understand a lot of things are happening side by side. Mental health, the mental health crisis, of course, is happening with this pandemic as well. A lot of concern has also been given about the fact that many other diseases are being ignored during this time, or they're not being given the due importance while they're happening. In this, you being a chief of infectious diseases and knowing that there's so much else going on, how do you think that can be better managed?
That's absolutely true. For example, in Hong Kong, the time a person was taking to call in an ambulance for chest pain increased 4 times because people are afraid to go to a hospital. So I think this is, number one, very true. Heart attacks and strokes and cancers are not just going to stop because there is a pandemic. Number two, it requires smart use of resources. For example, initially we were asking people to come to quarantine facilities or keeping people in the hospital for too long, particularly coronavirus patients. I don't think the science supports that. Much of this treatment can be done at home. We need to protect hospital capacity for sicker patients, and then we need to compartmentalize these patients as best as we can by COVID units. So 20 coronavirus patients can be held in a different part of the building to reestablish trust among people that if you have chest pain and you have a heart attack, you will be safe in this hospital. You will not catch the disease. So once again, very important question, requires a much detailed operational answer. And many countries have done it. Once again, it's not that big of an issue of resources. It's an issue of mindset. You have the right mindset, it can be done.
Right. I want to shift gears a little and talk about the information we have about race and ethnicity playing a role in perhaps not getting such a strong case of COVID-19. Now, in the beginning of when this pandemic was spreading across the world, we saw countries in South Asia not having that same drastic impact. We also heard a lot about different races being impacted differently. Now, when we know the science, now when we're able to see what's happening unfold, what more do we know about this? Is there a difference between who gets impacted?
Probably not. And I know this is very controversial, but I will simply tell you this, that if the fuel gauge in your car was broken, we could argue all day long how much gas or how much petrol is left in your car, but we just don't know. The fuel gauge is broken. In this particular case in Pakistan, unfortunately, and many other developing countries, we have literally done less than 0.5% of the testing. So 99.5% of Pakistan's population is not tested against coronavirus. When you have that sort of a broken fuel gauge, it's very, very difficult. We can argue all day long, but I think the virus's behavior is pretty similar globally. The death toll in Pakistan is 6 times less than Iran. That's hard to believe. A virus is not going to behave differently just because there's a border in between. And Iran's death toll is 6 times less than Spain. Science doesn't work that way. Science is typically reproducible. If you jump from a building, the second floor of a building, you're coming down at the same speed, whether that's California or whether that's Kamuki. So I think the virus may have some variation, but not that big of a variation.
Right. It can be as big as being portrayed here. Now, I just want to put one last question to you, and this goes to social interactions. You've mentioned this before, that we need to take the necessary precautions. But a lot of people, given that they're experiencing mental health issues and given how this is an unnatural way to live, the social isolation, if people want to meet, would you recommend that? And if people meet with masks, how much protection does that give them in enclosed spaces and in open spaces?
Yeah, I think there is no, first of all, there is no thing in life that is risk-free. So there is some risk in everything. I think people have to always weigh the risk and benefit. Is this a birthday party that can be avoided? Or is this something very, very critical where you have to meet? So number one, be honest to yourself and not just try to convince yourself that it's okay for us to get together, 50 of us, number one. Number two, if space allows, even when you meet your friends, families, relatives, try to stay 4, 5, 6 feet away. If you can wear a mask, that will always be better. Wash your hands. And the most important thing, once again, in our culture, and I think it's changing now, but if someone is coughing, they're sneezing, or they have symptoms, they must not go anywhere. If you have a fever, if you're having extra fatigue. So making sure you isolate very, very quickly and not have social barriers, because some people take offense to it. Oh, you are not coming close to me just because I have a little cough. No, it's not a question of coming close to you. It's a question of keeping everyone else in the family safe. So I think do the basic things, start from the innermost easiest things, keep some distance, wear a mask, wash your hands. If somebody's sick, let them stay home alone. And number 5, if it's something avoidable, then just do FaceTime, stay with technology, and defer that meeting another couple of months when things are better.
Dr. Faheem Younus, I said that was going to be the last question, but I do want to put one more question to you, given that is specific to our context, which is the joint family system and how people who are living in those families with vulnerable populations, how they can cope with this pandemic. That is coming out to be one of the major issues, especially in the Pakistani context and the Indian context.
So first of all, if you have 10 people in a family and nobody's going outside, I think you're all safe, because if everybody's asymptomatic for a week, 10 days, that means nobody's a carrier and they're not going to have the disease. What happens in reality is 1 or 2 people are probably going out to make a living and they're coming back home. And that's where the risk is going to come from. So just make sure, again, when you come home, don't go crazy. Don't worry about your shoes and your clothes. Typically, this infection is not going to come through the soles of your shoes. But wash your hands. Make sure you're taking your temperature every day. If I'm the head of the household, I'm going outside, I have to be extra careful in how I carry myself all day long. And then the moment I get symptoms, I need to separate from others. I still feel that people who have symptoms likely are more contagious than who are never going to develop symptoms. In that pre-symptomatic phase, just a day before you're going to get sick, yes, you can be quite contagious. So there are those complexities, but you have to live within your reality. I think if people are able, as long as we don't have to be 100% correct here. This is the message I want to give people. If you're 80% correct, but if all of us, if every person in Pakistan is 80% correct, you will defeat this virus even without a vaccine. You don't have to be 100% correct. A vaccine doesn't have to be 100% effective. A treatment doesn't have to be 100% effective. 80% will be good enough, but unified 80%.
Right, and that's, I think, what everyone needs to say for being unified during this pandemic, having a unified stance towards it, unified policies without undermining each other, leg pulling. Thank you so much, Dr. Faheem Younus, for taking out the time and talking to us. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.